Hi, this is Sophie here at Hope Pharmacy with pharmacist Sadaka Chow. Today's 10 questions are on Eliquis, so let's start. Hi, Sadaka. What is Eliquis and what is it used for?
Hi, Sophie. Eliquis is an anticoagulant, also known as a blood thinner. It's used to reduce the risk of stroke and blood clots in people with atrial fibrillation, which is a condition that causes an irregular heartbeat. It's also used to prevent deep vein thrombosis and pulmonary embolism.
Got it. How should you take Eliquis?
It's typically taken twice a day with or without food. It's important to take it at the same time each day to maintain consistent blood levels. If you miss a dose, take it as soon as you remember it. But if it's almost time for your next dose, skip that dose and resume your regular schedule. Do not double up the dose to make up for a missed dose.
Good to know. Are there any common side effects you should be aware of?
Yes, there are. Some common side effects of Eliquis include easy bruising, some minor bleeding like nosebleeds or bleeding gums, and nausea. But if you experience any severe bleeding, such as prolonged bleeding from cuts, unusual bleeding from the gums, heavy menstrual bleeding, or blood in the urine or stool, seek medical attention immediately.
Got it. Do you need to avoid any foods or drink while taking Eliquis?
Well, unlike some other anticoagulants like warfarin, Eliquis does not have specific dietary restrictions. However, it's still important to eat a balanced diet and avoid excessive alcohol consumption, as alcohol can increase your risk of bleeding.
Got it. Can Eliquis interact with other medications?
Yes, it can. Eliquis can interact with other medications, including over-the-counter drugs and supplements. Some notable interactions include other anticoagulants, anti-inflammatories like ibuprofen or aspirin, and certain antidepressants. Always inform your healthcare provider or pharmacist of all the meds and supplements you are taking.
Got it. What should you do if you need surgery or dental work while taking Eliquis?
That's an excellent question. Inform your surgeon or dentist that you are taking Eliquis. You may need to stop taking Eliquis before the procedure to reduce the risk of excessive bleeding. Your healthcare provider will give you specific instructions on when to stop and resume taking Eliquis.
All right, well, good to know. How will you know if Eliquis is working effectively?
Unlike some of the other anticoagulants, Eliquis does not require regular blood tests to monitor its effectiveness. However, you should keep regular appointments with your healthcare provider and report any signs of bleeding or other side effects. Your provider may order occasional blood tests to check your kidney function and overall health.
I see. Is there a risk of bleeding with Eliquis, and how can you reduce it?
Yes, because it's an anticoagulant, Eliquis can increase the risk of bleeding. To reduce this risk, you want to follow your doctor's instructions carefully, avoid activities that may cause injury, and use caution when using sharp objects. If you experience unusual or severe bleeding, remember, seek medical attention and help immediately.
Got it. What should you do if you experience side effects or allergic reactions?
If you experience mild side effects such as bruising or minor bleeding, contact your healthcare provider for advice. But for signs of an allergic reaction, such as a rash, itching, swelling, severe dizziness, or difficulty breathing, you want to seek emergency medical attention immediately for that.
Got it. And last question, can you stop taking Eliquis if you feel better?
No, you should not stop taking it without consulting your healthcare provider. Stopping Eliquis suddenly can increase your risk of a stroke or other serious blood clots. If you have concerns or are experiencing side effects, talk to your doctor to discuss your options.
All right. Well, this is really good to know. Thank you, Sadaka. Have a good day.
Have a great day.